One of the amazing innovations we now have in the NICU is hypothermic therapy, which is care for babies that suffer lack of oxygen at delivery. With increased survivability of newborns, what we're focused on is the quality of that survival. This is really a growing area of neonatology.
What is done in the first few seconds of life and then the first few days, weeks of life makes a difference for the whole lifetime of that child. We'll be really one of the leaders in the nation for this. It's really exciting.
Type 1 diabetes is where your immune system is attacking your pancreas, which makes it so it cannot produce insulin. It was very sad. I had a big fear of needles too, so when they brought it in to show it to me, I was just like, wow, that I'd have to be doing this for the rest of my life. I just couldn't believe it.
This is a deadly disease. It's a disease that robs children of a normal childhood. We're talking about chronic diseases, and in many cases we don't have all the right answers. What we want to do is keep asking questions, is this the best we can do, or are there things that we can improve on? So a lot of the research that we're doing is asking important questions. If we're not happy with the outcome of this, how can we do it better to improve the lives of children with diabetes?
The Cruise and Health Mobile is a mobile medical doctor's office. So everything that happens in a doctor's office happens in our medical mobile van. We get to do the best job in the world. We get to be doctors and nurses that go take care of kids that are living in shelters or literally living on the streets. One of the great programs here is the Leadership Circle. And from those monies, we had direct increase ability to take care of children on the street. We actually were able to see more children. We were able to take care of their medical needs in a much more efficient way.
We have an active phase 1 trials where we're allowing our patients that would otherwise not have an opportunity to have experimental therapy to come to our center to cure their cancer.
We're the only people in the state who are actually doing early drug development phase 1 studies in pediatric patients. In the past, all our patients who wanted to go on phase 1 studies would have to go out of state.
Specifically, my interest is leukemia. 20 years ago, the survival rate was close to 50%. Now I have a 95 to 98% cure rate if they are a low-risk leukemia patient.
My son, Adam Isaiah Garay, was diagnosed at the age of 5 with CML, which is chronic myelogenous leukemia. It was very scary to know that our son had this disease that nothing could control. We kind of just had to put his life in the hands of other people.
Worst thing about leukemia is the painful shots.
A couple of weeks ago, we went in for his 1-year review, and the doctors finally released him as being 1 year in remission. They allowed him to go back to eating buffets and fountain drinks, little things that we take for granted. And the biggest thing is,
I don't have to wear my mask anymore.
Doesn't have to wear his mask anymore.
Leadership Circle provided Kids Rock Stars, our walking and running program, with some very essential funding that really kicked off an expansion for us in the community. It allowed us to provide walking and running programs in school settings. We went from 5 to, I think that year when we received that grant, to over 20 schools. Additionally, we expanded and literally doubled our program and said we're going to teach nutrition classes and activity programs to families so that they can understand healthy eating and contribute to their child's health, and also understand how to be an active family together.
Colin was diagnosed with severe aortic stenosis when he was 3 weeks old, and we had to rush to Phoenix Children's from the cardiologist's office, and he had to have a procedure within 24 hours to save his life, really.
We have 40 beds almost every day. Nearly every bed is filled. We have about 2,700 patients who are admitted to the ICU every year. About half of those kids have heart or neurologic disorders, and half of them have other medical conditions.
Colin is now 3 months old, and he spent most of his life at Phoenix Children's. We came from Michigan a year ago, so none of our family's here. So really, they've been our family for 2 months. 2 months that has seemed like 20 years. Everyone here has really supported us, and We couldn't have asked for better care.